Hey there, it's Mansfield today. It is a Wednesday, and that means we delve into matters medical with our resident GP, Dr. Vicky Skitter. Doctor, good day to you.
Hello, Jeremiah.
How are you?
Fine, and you?
I'm all right, except, I'm very glad you suggested we have this particular discussion that we're going to have today, because when I was a lightie, I used to ride horses. And as a result of that, I've got some serious lower back problems.
Oh, okay. And the horse? Oh, sorry.
Ooh, yeah, nah. You're starting so early.
Sharp.
Yes, today. And the thing is, when they do come to a fore, I'm never sure what I should do. When do you go to your GP or when do you go to a physio? Now, I know that you've lined up somebody you know and
Yes.
work with in the form of Nicoline Breed, who has her master's in physiotherapy. Nicoline, welcome to Mansfield today. Thank you for taking time out to join us. What should I do now? I've got a lower back problem. Should I pick up the phone and phone you, or should I pick up the phone and phone Dr. Vicky?
So with the lower back issue or any mechanical kind of pain, which is aggravated by an activity or by a certain movement, it's most of the time best to see a physio first. We are first-line practitioners, which means that we do not need, or the patient does not need, a referral from a doctor or a specialist to come see the physio. We diagnose, evaluate, and treat conditions or injuries which you don't need a referral for.
Okay, well then, how do you know if I phone you, if you should just say to me, slip like tablet, or if you say, no, you need to go and see Nicoline. What's the determining factors here?
So normally if you've got, if you suspect an illness, I would say, if it's like a bronchitis or infection or a fracture, a break or something. But I always get nervous when patients come to me and say, oh, my shoulder's so stiff, I can't, put my clothes on properly, and then I have to diagnose. The physios are great with anatomy, and their diagnostic skills are better than mine, I think, when it comes to mechanical pain. So if it's an illness or something, like Nicoline said, then probably go to your doctor first. But if it's an injury, or like she said, a mechanical pain, one should definitely go to the physio first, I think.
Okay, then the next question, Nicoline, is how do you choose your physio? I mean, what's the best way of doing that?
Jeremy, so I would say that the best way to do it is to phone your GP practice and ask who your GP works with and would like you to see. It depends very much on the type of injury or pain, whether you want to go see a physio that does everything, or you want to go see a physio that does dry needling or specialize in chronic pain. And the best way to find a speciality physio, if I can use that term, is to go to the SA Physio website, which is www.saphysio.co.za. And right at the top of the screen, you'll find a button that says Find Physio. When you click on that button, you can put in your suburb or area where you work or where you live, and then a drop-down menu comes down, which then gives you all the specialities of the physios, and you can see who's in your area. But I would say it might be the best thing to maybe just phone your GP's office, because there's a trust relationship between the GP and the physio.
I just go next door and I knock on a door. Help! So I'm lucky. Nicoline, tell me, what kind of different specialities are there in physiotherapy? Like, what kind of different physiotherapies do you get?
So like I mentioned, you get a generalist physio, which basically does everything: orthopedics, sports, mechanical pain, chest infections. But then you get physios that then specialize in seeing only kids, so the pediatric practices. You've got physios that specialize in neurology, in any musculoskeletal injury or dysfunction. Then you get dry needling therapists, hydrotherapy physios, orthopedic rehab physios, and then you get lymphedema physios or women's and men's health physios. So there's quite a big spectrum of specialities under physios.
Okay, so then once again, I suppose it would be best to go to your GP and say, look, this seems to be the problem. My legs are swelling up, or I can't move in this. Which sort of physio should I be seeing? Okay.
Yeah.
I've got to ask you this question, Nicoline. Don't you get home at night and just want to go to bed and go to sleep? Because I couldn't think of anything worse than standing all day and just rukking and drucking and plucking and doing all that sort of thing. I think it must be damned hard work.
It is damn hard work. You are quite correct. And I do mostly hands-on treatment. So I'll be there for an hour or 45 minutes just using my hands and doing the treatment. So if you see a lot of patients during the day, you are quite exhausted when you get home. But there's nothing like sitting in a corner when you've got a husband and 2 little kids at home. And my husband very often goes, 9:30 at night, won't you just quickly look at my back? And then, yeah.
Can you just give him a clap on his back?
I was just going to say, all I can see is a clap coming.
Pretty much, that or needles.
Oh, that's funny. Nicoline, tell me, I learn something new every day, and I've learned through the years about different ailments or problems that patients come to us for, and then we don't always realize that the physio can help with those kind of things. Like, I know one is Bell's palsy, and I've learned that. I think you stimulate the nerves or whatever. But what are other things that are strange that you can maybe tell us, things that you can do that people don't often think about seeing you for?
Yeah, so there's quite a few that I think people either don't know about, or it kind of slips their mind when it comes to that. So Bell's palsy definitely is one of the conditions, and then acute and chronic sinus infections. A physio can greatly decrease the discomfort and the swelling in the nasal passages and the sinus cavities. Then we also treat lymphedema and pain associated with cancers, especially breast cancer and like mastectomy. So we treat scar tissue after surgeries, which can have a massive effect on your mobility and your function. And then breastfeeding moms who struggle with breastfeeding, even colic and reflux babies, physios also treat. It's mainly believed that only chiros treat colic and reflux babies, but we do it as well. And then another thing that people think, oh no one can help me except medication and injections or drips, is migraines, arthritis, fibromyalgia, chronic pain patients. So all of those are the ones that come to mind immediately.
So there are a whole range of things that can be treated. I mean, I know I suffer from sinusitis, especially at this time of the year, really badly,
Yes.
because there's just so much going around. And I would never, ever think of going to a physio for sinusitis, you know what I mean?
So between your back pain and sinuses and all your chronic ailments, you should put her in your pocket. Carry her in your pocket,
Yeah.
Jeremy.
Okay, it was the last time I come to see you, Dr. Vicky. I'll walk next door again. Nicoline, thank you very much for your time. Thank you for joining us on Mansfield today. It's been lovely talking to you. And thank you for informing us about those. What I found the most interesting was all the different ailments that you can get treated by a physiotherapist. So thank you for your time. Appreciate it.
Bye.
Thank you. It was a pleasure.
Nicoline Breert, who has a master's degree in physiotherapy. Dr. Vicky, who has a degree in
Grappies.
in pulling the piss out of Jeremy. Yeah.
Sorry.
Lovely to see you again, and nice to have you with us. You can catch us next Wednesday again for more on what's happening in the medical world. Until then, goodbye.